Well, joining me now from our Bristol newsroom is the doctor and broadcaster Phil Hammond, who's also a Vice President of the Patients Association. Good evening to you.
Good evening.
He says this is a fair deal, but if, and there's no sign of a resolution at the moment, if that remains the case, what happens next?
Well, probably the best thing to do would be a scientific trial. He says he thinks it's the right thing, but science works in unusual ways, and until you've tested something, you don't actually know whether it's going to improve it or not. My understanding is the BMA junior doctors have come up with their own cost-neutral proposal, which Jeremy Hunt rejected, and he's come up with a proposal which they've rejected. So the best thing to do, because there's no hurry to impose this, would be to do a scientific trial in different hospitals, comparing these two shift systems and seeing which actually delivers the best care and the safest care. Part of this dispute has been about science all the way from the beginning, how doctors feel Jeremy Hunt has misinterpreted the mortality data, drawn the wrong conclusions from it, uses outdated stroke data, gained access to the data on mortality rates before it was published, which is actually against the scientific method. So they basically want to trust the science rather than the Health Secretary, and the most sensible way of doing it would be to do a proper clinical trial of these two rota systems.
Trouble with all that is we are where we are. It is beginning to look as though the two sides are so entrenched, for whatever reasons, they're not going to give way. So if there is an imposition of this contract, what will that do to those doctors who are currently out on the picket line, to those who are thinking of going into this vocational profession?
Well, we already know that numbers in applying to medical school has dropped off, and people going into higher specialist training, taking a break from their junior doctor years, a lot of them are actually taking career breaks or not coming back to the NHS, so already it's had an effect. I think imposition would be a terrible thing to do, because medicine relies on the notion of informed consent. You have to collaborate, you have to sit down and agree, based on sometimes complex and imperfect evidence. And the NHS relies on a huge amount of fairly fragile goodwill. Most doctors and nurses work far more hours than they're actually paid or logged for. And if that goodwill was to go, which is what would happen, I think, if a contract was imposed, it would have a tragic effect on the NHS. Ultimately, this has to be sorted out by talking, but on both sides. They have to keep negotiating, I think. But if the government need to recognise two things. The first thing is they need to start talking, I think, monetary sense. The idea that you can have a 7-day NHS without any extra funding is nonsense. We already provide a 7-day emergency NHS and a 5-day routine NHS. The government has pledged to provide a 7-day routine NHS, which means 40% more routine work at weekends without any extra resources or staffing. That's just basically Huntonomics. Nobody actually believes that that is possible. So if the government were to admit that you could only have a truly 7-day NHS with proper funding, truly 7-day funding, then I think a lot of these issues would be resolved fairly quickly.
You have to say the mood music at the moment would suggest the government aren't going to do that. I'm just wondering, at the moment, of course, huge public support for the junior doctors. But in real life terms, very few people are affected by what they're doing. 2,500 patients in a population of 64 million. But if the strikes go up a notch and, say, other services, including accident and emergency, become affected, do you think public support may just change a bit?
I think it might. With my Patients Association hat on, I would strongly advise junior doctors not to go for an all-out strike. I think, you know, already when you do a routine, when you don't do routine work, there's a risk that patients in that grey area between routine and emergency could suffer, and that's a very real risk. I think of pulling out of emergency care would pose very real risk to patients, which I wouldn't advise. I think ultimately what we need is to keep talking. But the thing I suppose that inspires me is that these junior doctors are our future clinical leaders. They're brave enough to speak up. Jeremy Hunt has said he wants and welcomes whistleblowers. We now have 54,000 new whistleblowers. All Jeremy Hunt has to do is to listen to them, because they're the best smoke alarm for the state of the NHS. The reason 98% of them voted in favour of industrial action is they're saying presently our working conditions are pretty unsustainable. They're incredibly stressful. We're going to have flatline funding of the NHS and huge cuts in social care over 10 years, and we're buckling under the pressure. So don't suddenly pretend you can extend services to 7 days without adequate funding and staffing. Let's start having a sensible debate about the resources, and have it with the public too, because we're the ones who pay for the NHS, and ultimately we need to decide how much we want to put into NHS and social care. At the moment it's less than other European countries. Until we get up to that European level, we won't have the NHS and social care system we deserve.
Dr. Phil Hammond in Bristol, thank you very much for joining us.
Thank you.